Hi, my name is Ruth. I am 45 years old and I have been diagnosed with osteoarthritis. I was diagnosed with osteoarthritis about a year ago. I was first diagnosed when I noticed my body began to ache more, and I had originally associated it as me getting older. But then I realized, at my age, at 45, I probably shouldn't be feeling this bad, this achy. I mean, I was even having trouble getting out of bed. It was taking me about like 30 minutes or so to get out of bed each morning, because my knees and my hips were just so stiff. So at that point is when I realized, when I couldn't go up the steps the way I used to, I realized I should see my doctor. And upon seeing my doctor, he did diagnose me with osteoarthritis in both my hips and my knees. Turns out it's actually genetics. So my mother, she actually had osteoarthritis, and being a little girl at the time, I didn't really know exactly what that meant. I just knew that she was always in pain, but my doctor says it's most likely the reason I have developed osteoarthritis at such a young age. About 6 months ago, I actually developed osteoarthritis in my hands. So I first started noticing this when I was folding laundry and I just couldn't grab things the way I used to without my hands just feeling stiff. And it's what my doctor has referred to as gelling. But I started developing that. I couldn't even open canned goods without my son's help. And the one that really impacted me in my life was that I noticed I couldn't knit the way I used to. So I have been a knitter since I was 12. I grew up knitting, and when I started to notice it more in my hands, I couldn't even do that, my normal hobby. So that's when it really started to negatively impact my life, and I just saw how much of my everyday activities this disease was taking over. So with being diagnosed with osteoarthritis, my daily activities have been greatly impacted. It's the little things that you don't even think about, that you take for granted, having the ability to do the things. So like I can't fold laundry the way I used to. I can't open canned goods, and even opening boxes for when I'm cooking, I struggle doing that. I Even little things like pumping my own gas, I can't do that any longer. So it's just little things that initially I felt very frustrated and angry and depressed, and a whole mix of emotions. Being frustrated that for being 45 years old and taking care of myself previously, and now I'm forced to rely on other people to help me with daily activities, it really does affect your self-esteem and just your emotions altogether. It makes you feel very depressed. But luckily for me, being divorced, I do actually have a son who's 20 years old, so I do rely on him quite often. But even with that, I feel very, very much so a burden on his life, the fact that I do have to rely on him to do even normal activities.
It's just really difficult with my mother's osteoarthritis. I love my mom and I love taking care of her, but sometimes it's just extremely difficult. I'm in college now. I have a lot of schoolwork to get done. I work. I have a job. I like to spend time with my friends. And, unfortunately, she needs a lot of help. A lot of times I'll be out with my friends and she calls me to tell me that she needs gas, or that she bought a case of waters and she can't bring them in the house, or that she's cooking a meal and she needs help opening a can or something like that. It's become very difficult. And it's hard for me too, but I know that she doesn't really have many other people, and I don't want to make her feel like she's a burden in my life, because I know how frustrated she is with the pain and everything like that, and I can't imagine how difficult it must be on her, because I hear her sometimes being really frustrated when she can't do things. And I know that I'm the only one that's there for her, but sometimes it's just extremely difficult to go out of my way all the time and set my life aside just to help her do little things that everyone does every day.
First being diagnosed, my doctor gave me various medications to use for it. So he gave me that one cream, Voltaren, I believe is what it was called. He gave me Voltaren, which I would put directly on like where my joints were bothering me, so like my knee, my hands. He gave me that to use, and then he also told me I could take Tylenol for the pain as needed. And then later on, he did actually give me prednisone too to take when I felt like just different times that what he refers to as flare-ups, I guess. You know, when suddenly I'm just having this strong pain again.
So osteoarthritis is actually the degradation of cartilage and the underlying bone, and it is typically seen in the hands, knees, and the hip. Osteoarthritis is typically seen in patients who are female, and there is actually a genetic component to osteoarthritis where 40 to 60% of osteoarthritis occurring in the hips and the knees do come from some sort of genetic factor. Unfortunately, there aren't any medications used to cure osteoarthritis, but there are many medications used to control and manage the symptoms associated with the disease. For instance, topical applications like Voltaren gel or Tylenol can be used to control or manage the symptoms of osteoarthritis. If that doesn't work, then systemic NSAIDs such as ibuprofen or naproxen can be used, and hopefully that will reduce the inflammation associated with osteoarthritis. If a patient were to experience any sort of flare-up with osteoarthritis, then a low-dose corticosteroid like prednisone would be prescribed to help relieve the inflammation associated with the flare-up. In addition, opioids are not to be recommended to be used because the benefits do not outweigh the risks associated with use in osteoarthritis. We also suggest that patients, explore other routes besides medications like physical therapy, acupuncture, or even Tai Chi. And if the patient does experience or seem like they are a little bit overweight or maybe obese, then we do, of course, encourage patients to exercise to help reduce the weight. And hopefully, with all of that said, the symptoms associated with osteoarthritis can be managed to little or none at all.
Frustrated because I feel like regardless what the doctor has given me, it doesn't seem like it's enough. I have that stiffness still. I have that pain when I walk. Like I can't walk up the steps without feeling it. If I can't do activities the way I used to exercise all the time, and I feel very limited to do that because I just get pain and I just want to stop. But I think the hardest part is that it's just been very frustrating that it isn't like curable or easily fixed. So I'm hoping that my doctor can give me something else that can help me out.
Hi Ruth, how you doing?
Hi doctor, doing well, how are you?
Good. How's
to see
everything
you.
been going?
It's alright. I feel like I'm getting a hold of this a little bit better. Originally it was affecting me a lot, like emotionally, when I felt like I couldn't really do much on my own for myself anymore. But recently I am coming to terms with it a little bit more. Now it's just, I actually came in today because I feel like my knee, I don't know if it's another flare-up or what. I know I've had one of those before, but it actually feels like really hot to touch. So I don't know if it's inflammation again or what exactly, but it has been bothering me a little bit more. It's a little bit more stiff than usual, a little bit more pain with it. So I just wanted to come in and check up with you.
Yeah, it does look like there is some inflammation with your knees. So I know we did try to explore the route of the low-dose corticosteroid. We did go with prednisone. How did that work for you last time?
I mean, it helped. I was still having quite a bit of pain with it. So yeah, I mean, I guess it helped a little bit.
Would you be willing to try that again to try to reduce the inflammation associated with this flare-up?
I mean, I guess if that's like a good option. I mean, I was hoping, is there anything possibly stronger I could take, or?
What were you thinking?
I mean, I'm just looking more so for something for the pain. I mean, I know that there's a lot of strong medications that I can use. Could I use those in my situation? Just because sometimes the pain is really unbearable.
Are you thinking along the lines of an opioid or something like that?
I guess that's what they're called. I don't know. I've just heard of strong pain medications.
Yeah, you know what? Unfortunately, there isn't evidence to support the use of opioids in osteoarthritis. In fact, the risks actually outweigh the benefits.
Oh,
So, you know, we typically try to stay away from,
Okay.
you know, opioids
Right.
in osteoarthritis.
okay.
So, yeah, I mean, I know you're currently taking Tylenol as needed,
Right,
you know, for the pain, and, you know, if you are experiencing a lot of pain with this flare-up, just, you know, make sure to take that Tylenol as
Okay.
needed. And are you still using the Voltaren gel?
Yeah,
Okay.
yeah, I still use that as
Okay.
well.
And you're using that every day?
Yeah, out,
Okay,
yeah.
that's good. All right, have you tried exercising or anything like that, trying to stay active?
So, I mean, as you know, I was really into exercising like a while ago before this happened, so, I mean, I've been trying to do more. I just have found, you know, that when I'm exercising for long periods at a time, I just get like very sore
Right.
and like that stiffness again. But I mean, I have been trying to take it slowly. I do understand I'm not gonna go like right back into it, but I have been doing some exercise. I mean, is there anything else I can do really
Yeah.
to help this?
Yeah, you know, physical therapy is a great alternative and, you know, great option that we can definitely try. And I know of a few physical therapists in the area that I can refer you to,
Okay.
if you are interested with that. And, you know, if you do decide to use physical therapy as a means to try to help with your osteoarthritis and that still doesn't work, there are other alternatives as well,
Okay.
like acupuncture or even Tai Chi.
Okay.
So, you know.
Okay. I mean, the only thing is, like, it's physical therapy, is that pretty expensive? I feel like I have some friends that do it, and it sounds like it's really expensive.
Yeah, it could be pricey, especially if your insurance doesn't cover it. However, I know you have a pretty good insurance plan, so
Yeah.
I think that it will cover it.
Okay, good.
Yeah.
Yeah.
So, I mean, of course, I can always check for you.
Okay,
So that's not a
perfect.
problem.
Yeah. I mean, that sounds like a good option though for
Yeah.
me.
Yeah,
Like,
I
is that
highly encourage
normally,
it.
like, do people usually do the other things too on top of the medication
I would say
use?
I would
or-
say most patients typically go with the physical therapy route first, and then if
Okay.
that doesn't work, they'll go with like acupuncture or
Okay.
Tai Chi or something.
But I
like
mean,
that.
like, they do this using medications
Oh,
as
yeah.
well? Okay,
Definitely.
perfect.
Yep.
Okay.
Yeah.
So you said, are you gonna give me the prednisone then again?
Yeah,
or-
we're gonna try that again, and hopefully it should, you know, reduce the inflammation. You know, if you have any questions or any concerns, you can always, you know,
Yeah.
call our office or even call the pharmacist, and they should be able to assist you with any problems you're having. Okay?
Okay, one more question, I'm sorry.
Sure.
Would it help if I use like ibuprofen or something too with it, or?
So actually, if you were just to take the Tylenol instead of like ibuprofen or something like that,
Yeah,
Tylenol is actually, you know, just as effective or even more effective than ibuprofen. And, you know, since you have been taking the Tylenol already, we just want you to stay on that. You know, take it as needed for the pain. In addition, the NSAIDs like ibuprofen do have quite a bit lengthy side effect profile.
okay,
Some of the side effects do include bleeding, GI issues, and kidney issues as well. So, you know, since we have you on the Tylenol already, just continue to
Okay.
take that, and it should help you with your pain.
okay. I mean, I guess it's probably a good idea that I start exercising, and
Definitely.
I think I'm gonna consider that physical therapy, because I really haven't been doing much other than taking the medications, so I think that probably
Yeah.
would help, I'm sure.
Yeah, I'm sure it will. And also with the prednisone,
Uh-huh,
make sure to take it with food.
okay,
Okay.
okay, alright, thank you so much.
And I'll see you in 4 to 6 weeks then to see how your osteoarthritis
Okay,
is treating you. Okay.
okay, alright, thank you.
Yep, you got it. Have a good day.
You too. Having been diagnosed with osteoarthritis, my life has definitely been greatly impacted. You know, I can't do things the way I used to before. I can't go to church, you know, every week, depending on if my leg is bothering me. My hip, you know, I just can't do the same things I used to, and that really initially took like a very big emotional toll on me, just with feeling depressed and I guess hopeless even is a good word to describe how I was feeling. But you know, after speaking with my doctor, I am hopeful that, you know, we will come to a treatment plan for me, and incorporating things such as going to physical therapy, or even, you know, turning to acupuncture if the physical therapy doesn't help. I'm just gonna try my options, and hopefully I'll find a treatment with the medications and taking the prednisone and things like that that will get my symptoms under control, and I can maintain, you know, my daily activities. And if you actually feel it, it feels really warm to touch, so I don't know,
Yeah.
I don't know. One more question, I'm sorry.
Sure.
would it help if I use like ibuprofen or something too with it, or